Well, welcome back to Great Day Washington. If you are a woman who has ever dealt with urinary incontinence, you are not alone. NIH research shows that nearly 24% of women in the U.S. are affected with one or more pelvic floor disorders. And our next guests want to tell you about a unique treatment that can help you. I'm here with David Bowder of Weight Loss and Vitality Clinic and a patient, Eileen De La Selva. Welcome to Great Day Washington.
Thank you. Well, thanks for having us.
Absolutely. Now, this is a topic that women don't talk about, but we have all experienced it. Tell me, what is urinary incontinence?
So urinary incontinence is a disruption of the bladder floor where the bladder loses control of the urine. There's three primary causes of urinary incontinence. You have urgency, overflow, and stress incontinence. And this device kind of focuses treatment on all three different treatments.
Tell me about this device that your patient here is sitting in.
So what Eileen's sitting on, this chair, it's very, very new technology. Very innovative. Recently won an award over in Europe currently, just a couple months ago. And this device uses a similar technology as the MRI machine that we commonly use to check somebody's knee for an injury or a lower back, but it has a little bit stronger of a pulse. And this device stimulates the muscles of the pelvic floor and contracts them. Over about a 28-minute time period, this device provides 11,200 Kegel contractions. And by doing that, what it does is it re-strengthens the pelvic floor and really helps in supporting improvement of the urinary incontinence.
So it really helps, but we have your patient here to add more to that. So you're sitting there with the machine. How does it feel when you're going through treatment?
There's no pain, there's no discomfort, you're fully clothed. It's as if someone's tapping on the bottom of the chair and a little bit of vibration.
And how has it helped you?
I have regained my life, and I'm no longer buying pads. I'm able to join in all the exercises in my exercise class. It's made a big improvement, a big difference in my life.
Now, Eileen just said it there. Yeah. She's able to enjoy her life and exercise. What are the other treatment options out there?
Yeah, there's three primary treatment options that most patients or people are familiar with. You have the surgical option, the medications, and the absorption pads. All three are not extremely desirable. You know, with surgery, you have the complications of the general anesthetic, infections, about 15 to 25% of the time. With surgery, it doesn't even correct the problem at the end of all that investment. It's an expensive procedure. Medications riddled with side effects, lots of different side effects, from just simple nausea and vomiting, mood disorders, to more complicated side effects of medications to include blood in the urine. You know, so these medications can be pretty bad. And then with the pads, there's really nothing, you know, it does nothing to improve the quality of life. It doesn't do anything to treat the underlying condition of incontinency.
And did you ever consider surgery?
Yes, I was about 4 months out from having surgery. And I tried this, and it's worked for me.
And it's worked for you?
Yes.
Dave, how many times does someone have to go and get a treatment before it begins to work?
Yeah, so the typical protocol for this device is every 3 to 4 days, 28 minutes, and 6 total treatments. So over a course of 3 weeks, you can complete the entire treatment. Typically, people will see results within just a few treatments, but every now and then we'll have patients that will need the entire protocol to to see the full improvement.
Okay, so I'm looking at you sit here, and you said there was no discomfort. This does not hurt for you.
You can read a magazine, a book, no discomfort whatsoever.
Wow, this is amazing. Now, how widely available is this technology?
Yeah, so when we originally brought this machine into our clinic, this was one of 34, this was just a couple months ago, this was one of 34 machines across the country. And as far as I know, still, this is the only machine in the DC metro area and the Northern Virginia region. The next closest chair that I'm familiar with is in Richmond, Virginia.
In Richmond, wow. So people don't have to suffer in silence. Eileen, thank you for coming and being brave and talking about something that many women experience. So would you...
And don't talk about.
And don't talk about. Right. Would you suggest this for your best girlfriend?
Yes, I would.
You
My
would?
Mother, yes. Girlfriends, yes.
All
everybody.
Right.
It's a game changer.
A game changer for sure.
Mm-hmm.
Dave, tell the folks at home who are watching this, they're suffering alone in silence, where can they find you and get help?
Consultations are very, very easy. You can call the number on the screen, look us up on our webpage, weightlossandvitality.com. And for the listeners out there, the audience, we're offering a 40% discount for the service. You just call and make an appointment. And we also have interest-free financing available. It's a very, very affordable procedure. You can, for the most part, you can have this procedure done for what it costs less than have a cell phone bill per month. A very, very reasonable cost.
Well, Dave and Eileen, thank you so much. I want to remind the viewers at home to call right now to schedule a consultation. During the month of May, you heard it, you can get 40% off the Emsella treatment. All you have to do is call right now. The number is 202-600-9308. You can also visit weightlossvitality.com for more information. Thank you, and we'll be right back.
Stay right there because we'll have